So today's topic, we'd like to answer a question that we have received recently from a patient, and I think this topic can be addressed to our audience as well. So her question was, what do I do after a miscarriage? So this patient, who is also a friend of ours, she recently has experienced miscarriage, her first miscarriage, and then she has inquired help from Antai Hospital, and we are trying to give her our best support. And I feel like this is an excellent question that also can help a lot of other women out there. So the first thing after you do, after you experience a miscarriage, is that after going for the induced abortions and removal of the pregnancy tissues, you need to take some time to recover, you and your partner, both emotionally and physically. Take a few months to actually heal and absorb the experience. And secondly, please do not directly go into another pregnancy. Here at Antai Hospital, we have a policy of actually have to determine what exactly caused your previous miscarriage, because it is very likely that if you go into a pregnancy again, it will repeat itself. So another miscarriage will happen. So we urge couples to be under contraceptives. Do not get pregnant during this period until you are fully diagnosed. So in most cases, there is an immunological factor that is causing this miscarriage, and Antai Hospital specializes in the field of immunological miscarriage because we own the international patents for the diagnostics and treatment for immunological miscarriage. So that's the first thing that we will check for. So once you avoid pregnancy, you should quickly get to a specialist hospital just like Antai Hospital that specializes in miscarriage treatment, and then do a systemic check. So first thing, we will check for your immunological factor, which is the anti-embryonic antibody, which is the most common cause for a miscarriage. Secondly, we will also give you a 4D Panaromic ultrasound to figure out if there's any uterine factors or any ovarian factors, any diseases of these organs that is actually caused the miscarriage. Thirdly, we will also need to do a HisSG, which is a Hysterosalpingograph, which is to figure out and take a look at your uterus shape and size. Is there any blockage? Is there anything growing inside the uterus? And lastly, we will also need to do a standard hormonal check to actually observe and identify, is there any problems with your internal endocrine system. So with these 4 checks alone, we can already easily get a clear picture of what actually happened. So you do not need to do any other checkups where some hospitals may actually need you to go for surgery or some type of laparoscopic diagnostics. Actually, this 4 is already comprehensive enough.